FAVMI presents Unfolding Mental Illness, hosted by Saraswati Suresh.
Hello, everyone. FAVMI presents Unfolding Mental Illness. I am Saraswati Suresh, the host and founder of FAVMI, Family's Voice on Mental Illness, which is also the Mumbai Regional Zone of Families Alliance on Mental Illness, founded by Dr. Nirmala Srinivasan. My co host is Dr. Sachin Ganorkar, the founder member and director of FAVMI. With our episodes, we hope to reach more and more family carers looking after their loved ones suffering with some kind of mental health disorder and help them with tools, insights, and resources by conversing with mental health professions, lived experience, etc. Our 17th episode, we continue our conversation with Aman Batish, journey of a family carer with a person with mental illness. Now, Dr. Sachin Ganorkar, our host for today, will take it forward.
Thank you, Saraswati. Thanks a lot. Thank you, Amanji, for sharing your journey. I think I and Saraswati's heart goes to you, and we completely are with you with what you have explained and the candid way you have shared your journey. I think you have answered most of the questions that Saraswati mentioned, and I just wanted to comment this thing from Bhagavad Gita, where chapter 3, shlok 29, where they say that Prakriti Guna Sammuda Sajanti Guna Karmasu Tana Krita Vido Mandaha Kritasvina Vichalayet. Means as you overcome your ignorance, I think as you go close to the truth, you become better and better.
Yes.
And I think your what you shared with Saraswati is that as you keep accept and you understand it's a psychosocial disability, I think you come closer to the truth.
Yes.
I think with most of the questions being answered, we just wanted to understand that as an SMHA member of Haryana, what are the changes would you like to bring in the system?
That's a very important question. And I think, I would like to give a little bit of background before I answer this question. Right. See, I was, when my sister was not doing very well and, she was, she was in an acute condition and it was more or less becoming difficult, to keep her at home, manage her at home. So we started looking for facilities where, we could probably, send her without being worried much about her safety and, being a female, that she, exploitation and all those things would not happen. And also, the environment is relatively, good and up to the mark and, the kind that a middle class family probably would expect, right? So we were looking for those kind of facilities for us. But unfortunately, we could not come across any. And we realized for the first time how difficult it is to, manage such kind of, people and the kind of infrastructure or the facilities that are required are so lacking in the society, right? So that is the point where we first started to think about solutions, about what can we do about the situation, right? And be it at the government level or our own initiatives, what could be done. So I started talking to a lot of people and started brainstorming about what kind of solutions are available. And gradually we came to the realization, at least in North India, the situation is pretty bad. And, in South India, still there are, facilities and NGOs who are providing services. But in North India, there was hardly anything, especially for middle class families, where you could confidently, put your loved ones. So that is when the reality dawned on us, and we thought of, started something, maybe, take our own initiative and do something for ourselves. And in the process, maybe, benefiting others also. But then when I talk to a lot of psychiatrists and, people who are stakeholders and involved in the process, he told me that, it's a very difficult thing to do and many people have started and They have not been able to run the facilities, sustainably, and they've shut down. And I had also experienced the same thing in in my personal example, because my sister, we used to send her to a halfway home which was being run by an NGO in Karnal, which is a pretty well funded NGO otherwise, and even they could not run that halfway home for long, right? And my sister used to go there for a year or so maybe, and then that service was no longer available because they had to shut it down. They could not. So I then started looking at the reasons why things don't work, right? What are the reasons why things don't work, and what can government do, and what can private initiative, how can that help? And I realized, initially, then I realized that, one of the first constraints that I faced was, I found myself a little under-equipped in terms of know-how to, even properly research about it, So, because I had no background of, research, I had been a architectural design consultant, and throughout I had been doing consultancy, hardcore architectural consultancy I had done for from 2001 up to 2014. So I did not have any prior experience of doing research, and I wanted to find solutions that were not whimsical but were evidence and research based. But I did not know how to carry forward and do the research. So the idea of doing a PhD came from there, because I had anyways I had decided to bring about a change in the professional front. So I had moved into academics, so I thought maybe PhD would enable me to do find better solutions, because I would learn research methodology and how to do a proper database research and that kind of a thing. And then it would also probably benefit me if I continue to or decide to stay in academics. It would be an added benefit. So me and my family, we all collectively sat down and decided, there were many things happening, at the same time. I decided to bring about a change on the professional side. I decided to get into academics, decided to move into PhD, and all those things were interrelated. The objective ultimately was to find solutions through the PhD also, and that was the idea then. But then again, I didn't do a master's because I was busy with the profession. So getting into I took GATE, and I topped GATE. Usme, in all this, all these things happening simultaneously. 2017, I took GATE, and then I got into IIT Roorkee again to do my PhD. And that is where I started doing. I got access to international journals, and Elsevier's and all those through the system. So I'm giving this background to tell you about the concrete basis on which I'm saying the basis on which I am founding the expectations from the government. Yeah, what should the government do? This is the basis of it. So I did a lot of research and identified the stumbling blocks which affect the solutions, why solutions don't work, or the why things don't work, or what are the stumbling blocks in providing solutions to families like us. The first and the foremost stumbling block that I came across was a resource crunch. Right, enough resources are not available. There is a crunch of manpower resource, the kind of skilled, unskilled, semi-skilled resources that you require to take care of such people or such PMIs. They are not adequately available in the first place. So that is one major crunch. Another issue that I identified was that caregiver families themselves, they have their own peculiar issues, right? The biggest issue that these families have is a trust deficit, and it is they're not to be blamed for it. It is because of their situation, because the loved ones are in a vulnerable position. Many a times they are not even in a position to tell if somebody is exploiting them, right? So it is very difficult for them to trust anybody just like that, or blindly. So they are very cautious about getting into trusting somebody, seeking help, or even getting into an institution or leaving their PMI in that institution. So they're they have a conservative approach about it. And then also, there is also lack of awareness in caregivers about the kind of solutions that are available in the first place. They are so engrossed in their day-to-day caregiving process, and that process itself is so, it tires them out. They face burnout, and many a times they are not even, they don't even have the sense left in them to seek solutions and see what is available around them, right? So they are not connected with each other. For example, of course, like, see, now I'm, a part of all these peer support groups, like Mission, for example, and Face Me, Shanti Delhi, their chapter in Delhi. But they are good peer support groups, but how many members do they have, and what are the numbers we are actually talking about in the society? So hardly, it's minuscule. People who actually get in touch with each other, or find solutions, share solutions. So these issues are there in the real life, which are major stumbling blocks in providing solutions for these families. Now the government, if you look at the mental health survey and look at the numbers, and it's a beautiful document. I think all caregivers should go through the National Mental Health Survey, at least cursorily. It will give them a lot of insights about the ground realities of the situation in India, even though it is not a very it is not a survey of the entire population. First of all, only 12 states have been were a part of the sample. Even my state, Haryana, was not surveyed. For example, from north, only Punjab and Uttar Pradesh were part of the sample, right? So, but nevertheless, it is the most comprehensive and the most authentic data that can be accessed as on date, because I haven't come across any recent studies, not at least state specific studies, so I haven't come across, right, which gives you data about individual state, for example, right? So if you look at that document, that itself points out to the state of affairs in India. It says that mental health is not a priority in the public health system of India, and that is the reality which I am also facing in SMHA Haryana. For example, um, the authority was constituted in 2020. December 2020, I got the mail, and regarding the confirmation of my membership, right? So I'm there as a member, as a representative of caregivers. So our tenure was for a duration of 3 years, and as per the bylaws, we should be having a meeting in every quarter, right? And you won't believe, our first meeting happened after our tenure had elapsed, and somebody woke up that the meeting hasn't happened, and the first meeting happened in 2024, after our tenure had elapsed. So that is the degree of uh, you can judge the kind of where things are placed in terms of priority as far as the public health system is concerned, right? And I'm pretty sure that this is the scenario more or less everywhere, right? Because I'll just share an anecdote. I mean, I don't mean to be criticizing anybody, or but just as a matter of fact, I'm stating this, right? I was very concerned about meeting Neora. So I tried to push some strings, and let's see if I could somehow force people into, or nudge people into taking notice that meetings were supposed to happen, and they have still not. I wrote some mails also, and nobody responded, right? So during the while I was getting frustrated, I also started talking to other people, other SMHA members about it, right? So one of the members in some group, they shared minutes of the meetings of the CMHA in one of the groups, and I was going through them, and I realized that CMHA did not have an operational bank account until their fifth meeting, right? So, and CMHA is supposed to, they are supposed to tighten the screws and, take notice of, what's happening at the state level and how are the state mental health authorities complying uh, with the laws and all. And, I was dumbstruck. I was, I was thinking, if that is the state of affairs, and in order to be a functional body, you need a bank account. First of all, that's the first thing. And if after 5 meetings you don't have a bank account for the CMHA, what do you expect from the SMHAs, right? But nevertheless, things have picked up from then. And after we had our first meeting, we had a good interaction with the ACS and the other members. And on the whole, I found the attitude, at least, in terms of vision and approach, it was on the positive side, and more, people were more, I would say, in terms of approach, they were forward looking, right? So I got some confidence from there. So thereafter, we had drafted the regulations also for the rules for compliance for the mental health establishments in the state. I was a part of that empowered committee. During the meeting, they had invited before the meeting some of the some feedback from people about what our expectations were, and I had noted some discrepancies and some points of concerns as a caregiver, and written a letter about it and given it to them in writing. So they kind of agreed, and everybody, the people who were there, they also liked the ideas and the view that I had presented there. So they asked me कि भाई आप ही कर लो, आप architect हो वैसे भी, तो at least जो building के rules हैं, because in my letter I had pointed out to them that many of the rules in the of the SMHA, they are of the nature which would tend to make the practices of existing psychiatrists or practicing psychiatrists very conservative, because of the fear of compliances and because of the fear of litigations. They would tend to keep themselves restricted to OPD practices, and they will not take in patients, because it will become unviable for them. And in the sense that उसके ऊपर से litigation का भी उनके मन में डर रहेगा. And as far as the infrastructure are concerned, there are many things where existing buildings में उनको retrofit करना is a difficult thing. I am an architect. I know that it won't be possible to do that in any case without substantial cost and without following destructive means, where you have to do dismantling, a lot of dismantling. So in the long run, it would prove to be counterproductive for the caregivers, because already there is a resource crunch, right? And अभी हमारे पास नया इंफ्रास्ट्रक्चर तो नहीं है, और पुराना जो इंफ्रास्ट्रक्चर विच इज ऑलरेडी फंक्शनिंग, उसको भी आउट ऑफ फियर ऑफ लिटिगेशन एंड आउट ऑफ फियर ऑफ compliances, if people will tend to shut down and not take in patients, the available respite mechanisms for caregivers will also suffer, right? So from that point of view, I had recommended a few changes that maybe it should be done in a phased manner, or maybe we could incentivize it in other ways. For example, like adopting a rating system for private establishments, where a rating system could be in place stating that this is a 2-star rated and this has this kind of facilities, and this is a 5-star rated facility. It has, so competitively people will naturally themselves upgrade their facilities, instead of coercing them and making them forcing them to do these changes, and in the process losing whatever is existing also, which would be detrimental to the cause of caregivers. So I had given them these points in writing, and they had taken cognizance, and they asked me कि आप ही इसको frame कीजिए. So we had framed those rules and forwarded it to SMHA, and I think it is in due process, and in a few days, or maybe in a couple of months, maybe it would come into force, and things would start getting better, and they will start working then on ground. So nutshell mein, the point that I'm trying to make is that we have to, as far as policy making is concerned, the decisions making has to be data based or evidence based. Right now, the other discrepancy or the loophole that the National Mental Health Survey points out in our system is that, especially in case of states, policy making is not data driven. It is not information driven. So there, see, the ground reality is something else, and the policy and the issues that you are trying to address is something different. So there is a gap there. As caregivers, we should also educate ourselves about the ground realities, and then have realistic expectations from the government, right? For example, if we know that there is a resource crunch, right? So the resource crunch is there for private entrepreneurships or private entrepreneurs, and it is also there for the government. For example, if human resource is not available, the government cannot, it cannot create human resource overnight, right? Even if the government starts today, it will still have to set up institutions where training can be provided to people, and those people, those children or students who would come for training, they will not get trained in one day. They will also have to take a course. That course will take its own time, and just after passing out, you don't expect them to become mature professionals. That will only come by experience. So unless we are talking about skilled, semi-skilled manpower resource, which cannot be generated overnight, we have to understand this fact, right? So the wise thing to do for all caregivers is to, which the National Mental Health Survey also suggests as a strategy, is to make efficient and innovative use of resource, right? So we need to learn to share resources, right? So the kind of the solutions that we have arrived at through our research, and we are propagating and promoting through our NGO, are evidence based, and it is based on, it is trying to address all these stumbling blocks, right? So we for example are trying to set up an assisted living community in Karnal at present, and the premise again is that it is the only viable solution where you can actually share resource. Otherwise, if the caregivers or the beneficiaries are scattered and the resource is scarce, it is very difficult to provide service to people. I mean, it becomes economically unviable for resource persons to provide service. It becomes more expensive. Ana jana, travel cost, everything increases, right? And then the trust issues that the caregivers have, which is another major stumbling block, those can also be addressed very effectively through this kind of these kind of projects where such families come to live together, because then they can supervise whatever staff and whatever um, facilities that are being provided, and they can run it themselves. So it is not only cost effective, it is also efficient use of resource, and it provides, most of the biggest advantage is that it provides peer support where you need it, at your home, right? So many a times we see that caregiver families, they tend to get distanced from even their close relatives at times, because after a certain point of time, you feel that even conversations don't have any common points, there is nothing you have in common, and आपके concerns बिल्कुल अलग होते हैं, उनके concerns बिल्कुल अलग होते हैं, तो बात ही नहीं होती है. So gradually these families become distanced, socially distanced also, and अब लेकिन support तो चाहिए, you need a support mechanism. So who better to than your peers, because they already are sailing in the same boat, so trust issues won't be there. They already know each other's problems very well. They can best address these solutions. And the most important issues that we came across, see, even though mental illnesses they are different, and different illnesses manifest different kind of symptoms, and therefore different strategies for management and different lines of treatment will have to be adopted. But caregivers across the domain of mental illnesses, we have talked to so many people across the domain of mental illnesses, caregivers have common concerns, right? And one of the biggest concerns and the most overwhelming concerns for all caregivers is what after us, right? Especially in cases where the PMI is largely dependent on, even for day-to-day care, on their caregivers. Even for example, in case of developmental disorders like autism, Down syndrome, mental retardation, all of these caregivers have the similar kind of concerns, and their concerns can be commonly addressed because the resource they require for this is common, right? So we have to develop this mindset of inclusivity, including people who need similar resource, and then efficiently utilizing the resource, right? And then present such kind of proposals to the government and see what help the government can provide. Because see, I've been an academician, and I've mentioned this on other platforms also. I have taught policy, I have studied policy making, and I've seen that how policy making has transformed in India. uh, Initially the government started after independence as a provider, but now gradually it has realized that it is too overwhelming for the government because of the size of the population to become a provider for everybody. So it has gradually shifted from becoming a provider to a facilitator and to an enabler, right? So the current focus in policy making is to enable people, right? Uh, और एट द मैक्स टू फैसिलिटेट, राइट? सो अगर हम इस तरीके का कोई प्रोजेक्ट लेकर के जाते हैं सरकार के पास, वी कैन एक्सपेक्ट देम टू फैसिलिटेट अस, मे बी बाय गिविंग अस इंसेंटिव्स, maybe in taxes, or maybe even providing a subsidized land. But to expect the government to create institutions in every place, I think that's an unreasonable demand and expectation from us also, right? So as caregivers, we need to educate ourselves about the ground realities and need to see what solutions will genuinely work. Instead of having a sentimental approach, we should have a pragmatic approach and a structured way of looking at things, finding structured solutions rather than cribbing about सरकार ये नहीं करती, सरकार वो नहीं करती, सरकार ऐसे नहीं करती, वैसा नहीं करती. But they also have constraints, they also have their systemic issues. Things will move at their own pace in the government. अगर हमें जल्दी solutions चाहिए, effective solutions चाहिए, then we have to collaborate, we have to work together, we have to also forego this conservative approach that we have, even though it may be founded on firm and very credible sort of concerns. Nevertheless, अगर हमें अपने लिए अपने लाइफ टाइम में solutions ढूंढने हैं, we have to give up this conservative approach and take that leap of faith. I have seen so many people who are doing good work. For example, Sumana Trust, they are also coming up with a similar project in Bangalore. I would urge caregivers to come up and rise and have that risk taking ability. I know they are new, I know we are new, but since the infrastructure is not already pre-existing, having this expectation that आपको एक चलती हुई चीज मिल जाए which is running, which is risk free, and जिसमें आपका आपका पैसा, आपको ये डर ना हो कि वो डूब जाए, ये छोड़ करके हमें करना पड़ेगा. We will have to come out of this mold of being conservative and always being overcautious, and we will have to take this leap of faith, support such groups who are trying to set up these kind of facilities. Only then solutions will be created. It is absurd to expect the government to do everything for you. That is not going to happen. That is what at least the data or the numbers show, right? We all know the size of the Indian population. We know 30, this survey says 13.7% people require active intervention once over their lifetime, at least once or something, at least prevalence, lifetime prevalence 13.7%. और वो ये भी कह रहे हैं कि it is not just the PMIs, the caregivers are also adversely affected. Their quality of life, their professional personal life is affected. They also say that caregivers or the family persons who are looking after such people, they will take 10 to 20 days off in every quarter. This is their survey findings, right? I'm not quoting from my side, right? तो जब हमें पता है कि इतना लॉस ऑफ प्रोडक्टिविटी होता है, राइट, केयर गिवर्स के लिए भी, तो फिर हम why can't we take bold steps and give up our conservative approach and safe approach? अपना comfort zone में से बाहर क्यों हम निकलना नहीं चाहते हैं, right? I hope I have made my point clear.
नहीं नहीं अमन जी बहुत बहुत शुक्रिया नहीं मतलब सरस्वती और मैं तो बहुत शुक्रगुजार है वी आर लाइक इन डीप ग्रैटिट्यूड कि आपने इतने कैंडिडली अपना जर्नी शेयर किया और आप जो सोल्यूशन सजेस्ट कर रहे हैं एज एसएमएचए मेंबर जो आपने खुद ने स्ट्रगल से आप बता रहे हैं आई थिंक वो हमारे सबके लिए लर्निंग है मतलब बहुत बड़ी सीख है आज और सरस्वती और मैं बहुत ही शुक्र वी आर लाइक थैंक यू दैट वी आर हैविंग दिस कॉन्वर्सेशन एंड वी आर ऑल्सो रिफ्लेक्टिंग व्हेन यू आर टॉकिंग तो हमारे मन में भी उतना ही हम सोच रहे हैं कि क्या करना चाहिए और आपकी जो बातें एकदम सही है मतलब हम भी उसी उससे गुजर रहे हैं और शायद हम अपनी कहानियां इसलिए शेयर करते हैं कि लोग उससे कुछ सीखें और हम भी अपने आप को सशक्त बनाएं और आप सही कह रहे हैं कि अगर हम सब कुछ बना बनाया चाहते हैं तो वो नहीं होगा आई थिंक हमें भी
Right.
उतना ही संघर्ष करना पड़ेगा और शायद हमें उस संघर्ष के लिए हमने जो देखा है और हम शायद वो फाउंडेशन रख सकते हैं दूसरे लोगों के लिए जो हमसे
Right.
आगे आएंगे
Absolutely.
और
Absolutely.
आपने सही कहा कि शायद आज हम जो डिस्कस कर रहे हैं शायद मैं सरस्वती और हम कोविड के पहले सोच भी नहीं सकते थे कि हम अपने लाइफ टाइम में डिस्कस कर पाएंगे
Right.
किसी भी खुले मंच पे क्योंकि जो शर्म होती है या एक लगता है कि लोग क्या कहेंगे या हम सोशली जो आइसोलेट हो जाते हैं जैसे आपने बिल्कुल सही कहा
Right.
पर शायद कोविड से कुछ अच्छा भी हुआ है हम आई थिंक सब मिलके इस प्लेटफॉर्म पे कुछ डिस्कस कर पाए तो सरस्वती और मेरी तरफ से बहुत बहुत शुक्रिया
Thank you
और
so
हम
much.
शायद ये मे बी वील हैव वन मोर कॉन्वर्सेशन अबाउट जो आप डिस्कशन कर रहे हैं मे बी वी कैन हैव अ सेपरेट टॉपिक एंड वी कैन टेक इट फर्दर
Certainly.
सो
Certainly.
सो फैमिली और सरस्वती जी और मेरी तरफ से आपको थैंक यू वेरी मच एंड थैंक यू फॉर योर टाइम
Thank you
Thank you
so
so
much.
much.
Thank
Thank
you
you
so
so
much for providing me the opportunity. And सचिन जी ने जो बात कही थी कोटेड फ्रॉम भगवत गीता मैं एक छोटा सा मैसेज आई नो इट इज़ ऑलरेडी क्वाइट अ लॉन्ग सेशन आई गेस तो छोटी सी बात है फॉर केयर गिवर्स अबाउट how to treat this as an opportunity. Again, in the Bhagavad Gita, chapter 7 verse 16, Bhagavan Krishna says that chaturvidha bhajante mam uh, uh, jana sukritino arjuna आर्तो जिज्ञासुर अर्थार्थी ज्ञानी च भरतर्षभ. So Krishna says basically that there are 4 types of pious men who start worshipping me, and the first category that he mentions is arth, or those who are suffering, right? So don't look upon this suffering as as a distress, or as something to feel bad about, but look at it as don't look at it as a stumbling block or a constraint. Look at it as an opportunity for progressing spiritually and for your own personal growth, right? Because, and I've seen that so many caregivers naturally tend to get drawn towards spirituality, और वो ऐसा ही it is not by chance or by accident that this happens. Bhagwan himself says in the Bhagavad Gita that it's an opportunity actually, right? And we should avail that opportunity. And this is also one of the learnings that we want to share through these projects that we want to make. Of course, the infrastructure part is one major aspect, because that is the respite mechanism for the caregivers. वो होने के बाद में, उसके बाद में हम उनको भगवत गीता और उसके बारे में कुछ बता सकते हैं. That is the starting point, because उससे पहले तो they probably won't even be in the state of mind or have that peace of mind to even assimilate that knowledge, right? तो उसमें बहुत opportunities का भगवान खुद कह रहे हैं, and you must avail this opportunity, use it for your own personal growth. And I think doing that will transform your lives. It will do wonders to you. With this message, I would like to end.
Thank you so much. Thank you so much. It was a wonderful conversation.
Thank you so much for giving me the opportunity of sharing, my learnings, and I hope it will be beneficial for people.
I'm sure it would be. Thank you.
Thank you so much.